Hello, everyone. The International Society of Physical and Rehabilitation Medicine will be held in November this year, and we couldn't be more excited to introduce one of our inspiring keynote speakers today, Professor Ahmed Oumri. He is a PRM specialist with expertise in interventional pain management, musculoskeletal ultrasound, and sports medicine. He currently serves as the head of the PRM department in the Mohammed VI University Hospital in Oujda, Morocco, the largest hospital in the Orient region. He is also the founder and president of the Moroccan Academy in Pain and Palliative Care and chairman of the North African chapter of the World Academy of Pain Medicine Ultrasonography. He is deeply committed to education, clinical innovation, and actively contributes to the advancement of pain medicine within rehabilitation frameworks. At the Congress, we look forward to his topic on interventional pain management, a game changer for PRM in developing countries. How are you going today, Professor Oumri?
Hello, Dr. Sang. Hello, everyone. I am very happy to be here to speak about my keynote lecture and also to speak about the pain and intervention and pain procedures. This topic changed not only my practice and my daily practice, my life, but also changed the life of many patients. And I am happy to share this topic with you and with all ISPRM colleagues around the world. I will start by phase, not a concept. I will start the history of this topic or this keynote of or my practice by boy, 12 years old, cerebral palsy with severe spasticity, hip and shoulder dislocation, and I received it with pain the whole day, 9 out of 10 in my clinic, and I was thinking I am PMR doctor and I can't do anything for this patients. No surgery, no medication, and nothing works for these patients. That's why I was thinking to start searching, training, and practicing some procedures. After this boys, now I receive it last week with a smile, without pain, and is good sleeping, and with Hakimi jersey, football jersey, and for this smile, I choose this path and I choose this way to integrate pain procedures and pain intervention and pain procedures and intervention pain management into PMR practice. It was for our patients and for us also as PMR.
Thank you for sharing with us that inspiring story. Can you give us a brief overview further of your topic for the Congress?
Okay, for the Congress, why we have chosen these topics, because it's very important, as you see, for us and for patients to integrate pain management into our daily practice. But as you see, in developing country have some limitation, and for some colleagues it's too hard to integrate these procedures, these advanced procedures, into the PMR clinic or PMR department. And also for other specialties, it's not easy for other specialties to integrate that PMR is doing procedures. PMR doctors are doing the focus of pain management, for example, in all departments. That's why I will share in my topics, my keynote lecture, how to train. The first is to training, to be curious, and how can we manage into a PMR department focus on pain into the PMR department, and how to make structure about this interventional pain procedures into our departments. The second topics I will talk about is some how to start procedures and how to start it easy, and after how to make it more advanced and to be more skillful.
Okay, so how do you envision the integration of interventional pain techniques into mainstream rehab practices?
Actually, this pain practice, pain procedures. Now, my hope is to be integrated in everywhere, every pain PMR department around the world, and particularly in developing country. Why it's important? It's important because I will show you just our history in our for our departments. When we integrate these procedures in our department, we receive more patients with more hope, because before we are, as you know, in our PMR, we are doing restoration of function. We are the PMR doctor, the physician of function. But not only we are the physician of function, we integrate pain procedures for our patients, and we receive more patients because of a lot of these patients don't have enough information about pain procedures and don't have access to pain procedures. And we have those patients in our department. That it's very important to integrate pain procedures into PMR department for the quality of life of this patient and for making more accuracy of our treatment. The second way, we before I remember we had just one resident in our department. Now we have 30 residents. 30 residents. Why we have 30 residents? Because we are more attractive for residents. Why we are more attractive? Because we make more process and we give hope to patients. We don't just want to integrate procedures for integrating procedures, but more we give hope for patients, and also we are more attractive for our residents.
No, that's really good to hear. And so, what advice would you give our young PRM physicians interested in pursuing advanced training in pain and musculoskeletal ultrasound, for example?
For me, the first advice is to be curious about not just procedures. We start easy with scanning, for example, scanning with ultrasound, making some question. Okay, how can we help those patients with pain? The second hand, the need to make a training. Training is very important. Training. We start with easy, we start simple, and we can advance level by level. And after training, the most important thing that you need to share after. Okay, you are a young physician, you make training, you make practice, share after with your colleague, with other colleagues, and you can share case reports, for example. You can submit case reports, you can discuss case reports. And the other thing is we don't have to we don't need high technology, we don't need high expense, we don't just need skills and one ultrasound, for example, for starting. It's easy. And I tell you, we start easy. We don't need to start with advanced procedures. We start easy with hydrodissection, nerve hydrodissection, for example, with joint injection or fascial release, for example. We start easy, and after we'll grow up together. And I hope that in the future we see all PMR doing interventional pain procedures in all our PMR departments around the world.
Absolutely, Prof. Oumri. And it's such, such a collaborative network as well. That comes to the end of the interview. So thank you so much for your time, for giving us this brief insight into what you'll be presenting at the Congress. And we really, really look forward to seeing you in Morocco at the ISPRM Congress and to hear your talk.
Thank you so much. And I'm looking to see you all in Morocco, in Marrakech. Thank you very much.
Thank you.